Hey there, this is Stacey the Baby Maker Roberts, and I'm coming to you with your tip for Fertility Friday. Now, I wanted to discuss something to you that's been in the research in the last couple days, and they're kind of making it seem like it's a new research, but it's actually old research about a very old and effective technique that seems to make it into medicine in regards to fertility, and then kind of loses its glory and then comes back in, etc., etc. Well, the good thing about this is, and why I wanted to share it with you, is there's a significant increase in pregnancy rates when you undergo this particular procedure, which could potentially help you avoid doing a more expensive procedure like IVF. Now, it's not for sure that it will help you avoid that, but I'm going to share the statistics with you in a minute so you can talk to your doctor about it. This particular technique I recommended and had been recommending over the years with patients, probably since the mid-2000s and beyond. But I have to admit, because some of my patients were having difficulty finding doctors who would utilize this particular procedure with this particular substance that I'm going to talk about in a minute, that I kind of moved away from it. But the research study definitely reminded me about this, and hopefully it's going to become more of a popular procedure because, as I said, it's definitely successful. See, in the early 2000s, probably potentially mid-2000s, what was happening, like 2004, 2006, I can't remember where, in New Zealand, they discovered that utilizing an iodized poppy seed oil and putting that through the women's tubes when the tubes were flushed, that's called an HSG, or hysterosalpingogram, significantly increased the natural pregnancy rates of women receiving that versus receiving like a saline solution or water pushed through the tubes. And that effect actually lasted all the way 24 months after they had the one procedure done, or the one flushing done. So they looked at a group of women who had, in a total of 24 months later, who had one of the flushes done. At the end of those 24 months, there were more women who had pregnancies naturally that had the oil flush with the poppy seed oil versus the water or saline flush. So it was something that they showed really had significant impact, but the study was a little bit smaller. Now the research has come out again, and it's actually was done by a doctor who believes he was born as a result of his mom having this flush done years and years ago with this particular substance, the iodized poppy seed oil, which is an oily substance pushed through the tubes. And in this particular study, what they found with the women that they looked at, and I believe it was in Australia, is that there was increased pregnancy rates in those women, natural pregnancy rates in those women up to 40%, whereas women who had the water or saline pushed through the tubes, they had a pregnancy rate of 29%. So there's definitely a significant improvement. So if you want to improve your chances of becoming pregnant naturally, that can be something that you could utilize. Now, I'd be curious to see if they're going to be doing any research in the future about whether doing that flush prior to going through something like IVF actually improves the IVF outcomes. But the bottom line is they still don't know, even though this procedure's supposedly been used for 100 years and definitely has been researched over the last 10 to 15 years, they don't know why it works. They don't know if the oil, because it's thicker, if there's a mucus plug or something in the tubes, if that is easier, makes it easier to push out that mucus plug because it's a little bit thicker versus the water. Or they don't know if potentially the poppy seed has some type of a effect on the immune system or inflammation that could make the uterus or the fallopian tubes or the sperm or the egg more receptive to creating a more viable pregnancy. Even the iodine that's utilized could potentially support anti-inflammatory properties in that peritoneal cavity or around the ovary where the egg is released. So there's so many different theories about why it works. They don't exactly know why, but they certainly know now, again, that it does work. So I would encourage you to ask your doctor about the Lipiodol flush. That's Lipiodol flush. And they can do what's called a hysterosalpingogram and flush that fluid, that oily fluid, through the tubes to try to create a better chance for a natural pregnancy. So I want to do more of these types of tips, things that can give you information that you can take to your doctor to talk about, things that you can pursue on your own here with Fertility Fridays, and also with my website at naturalfertility.com. So make sure you go ahead and subscribe to the website at naturalfertility.com if you want to see some of my older information, or it's really not old, it's still applicable today, but what I've written over the last 10 years. And remember, we have a private Facebook group for people who are wanting to talk about their fertility issues, but don't want to plaster it all over Facebook that they're a part of that type of a group that talks about fertility issues. Because as we know, and this may be for you, that you may not share with many people that you're dealing with fertility issues. So when it's a private or a secret group, which I don't really like that name, but when it's a private group like I've set up, it's not listed on your list of groups when people look at your profile. So this is a place where you can talk to other people who are dealing with fertility issues, and we're going to be focusing on the possibilities and lots of good information of what you can utilize to improve your chances to become pregnant. So I hope you join that, and if you would like to, please send me an email at info@naturalfertility.com, and I will send you a join request. And once you get in, what we're going to do is have the people who are in the group invite other people that they know. So it's going to be something where it's going to be a close-knit group that's going to be collaborating and supporting each other through dealing with fertility issues and focusing on the possibilities. I hope that sounds attractive to you, and I hope I see you in the group. And again, you can reach me at naturalfertility.com or info@naturalfertility.com. I look forward to seeing you next week. Take care. Have a great weekend.